So hi guys, how you guys doing? Welcome back to my YouTube channel, A Life of Amy. You know what to do. If you're new to this channel, kindly go and click on the subscribe button, click on the notification bell so you get notification when I post video. Like this video, drop your comment, okay? Let me know what you think. All right, and then don't forget to share this video, save my video, okay? So today I'm gonna be talking to us on premature ejaculation. So this is me asking, what is premature ejaculation? Now we say premature ejaculation is a sexual dysfunction, okay, that occurs when you come faster than expected. You see, you just orgasm, you just ejaculate, pium, within 1 minute or within 1 minute where you just enter woman. This is what we call premature ejaculation. Okay, and now premature ejaculation can happen. It can be a lifelong occurrence. What do I mean by lifelong occurrence? You see that you've had this experience. Okay, you've had this even before your first um intimacy experience. That's what I mean by lifelong. And then you can still have this, like, you notice that it can just be something not lifelong. First intimacy experience, you did not experience premature ejaculation, so it's just something that started occurring. Yes, that is it. Now, why do I call it premature, or why do we like call it premature ejaculation instead of just saying poor ejaculation or something, you understand, or fast ejaculation? Why it is tagged premature is, number one, premature ejaculation will never last more than 1 minute. You see, immediately you don't enter, pium, and the next thing, when the lady is expecting you to hit me, do me this one, do me this one, you just notice that, bros, otilo, you don't pour, kiniko. And you see, again, you see that it has been happening to you for the past 6 months. That is why we target premature. And then you see that, then again, it is constant. It usually happens almost all the time when you're having an intimacy with your partner. So that is why it starts premature. Now, most ladies don't know what premature ejaculation is. Now, premature ejaculation is not life threatening. Okay, it's not contagious. It's not like STD, no, or STI, no. So you see, it's something that you can manage. It is happening to you now. Oftentimes people ask, okay, because okay, since he's suffering from premature ejaculation, that means he's impotent. No, my sister, he's not impotent. As a matter of fact, a man suffering from premature ejaculation can pregnant you. You go play, you go enter. Yes. The only thing that happens, because he's suffering from premature ejaculation, it's time taking. It takes time, but that doesn't mean he's impotent. He's not impotent. Now, there are a lot of causes of premature ejaculation. There's 1 in a million reasons why people suffer from premature ejaculation. No, okay, now let's look at the psychological factor. Yes, why most people? Because at the end of the day, let me tell you, 30 to 40% of people with Ebola, they are suffering from premature ejaculation. Premature ejaculation can come as a result of anxiety, depression. Yes, it can come as a result of back and forth in relationship. Okay, it can come as a result of issues. High blood pressure can bring premature ejaculation. So that's why I will always say it is good to know what you do. Then too much alcohol intake can bring in premature ejaculation. Drug abuse, too much excessive drug intake, self-medication can lead to premature ejaculation. Now let's talk about the biological aspect of it. It can come as a result of traits, from maybe family traits or something. Yes. Then it can come as a result of health issue. Yes, diabetes, high blood pressure, a lot of things can actually uh what are they, prostrate can actually bring in premature ejaculation. And then swelling too can actually, prostrate and swelling can actually bring premature ejaculation. Now we talk about the this aspect of it, behavioral aspect of it. So you see that at the end of the day, so much can go wrong. Depression can bring in premature ejaculation. It's just to tell you that body differs. That's why we always say, know your body type, know what works for you and what doesn't work for you. Body differs. And I will always say this to all these guys that always have excessive alcohol and drug intake: stop. Because a vehicle will reach the final destination doesn't mean you will follow the vehicle to the last bus stop. You can get to your own stop where you know that this is my destination. You drop, you alight, and then let others continue with their journey. There's always a stop to these things. Why waste your life? Why do more harm than good? You can work on that. Okay. And then for those of you that will always reach out to me asking for private talk where you lay down your issues with me, I so much appreciate you guys. Thank you for even trusting me enough to let me be part of your life. You understand? It is okay. Thank you guys so much. I appreciate. But then I will say this, there are people that will reach out to me. I will always take you back to, have you seen a doctor? I understand that there are cases that are so sensitive that you feel you don't even know how to walk, how to get to a hospital. Talk more of saying, doctor, I'm suffering from premature ejaculation, or doctor, I'm suffering from this. Now, I've had a guy approach me, and then he was suffering from premature ejaculation. After I was done talking to him, bottom line is that I convinced him. I said, go to hospital. When he got to the hospital, after the checkup and everything, seeing a doctor, it was finalized that he was having premature ejaculation as a result of anxiety. You see, most times these things are not that deep. They are not that deep. Let's not make mountain out of a molehill. Now, do not let anybody make you feel less of yourself for one thing or the other. You are perfect. You are the best kind that God has ever made. Be it you have health challenges or whatever it is. Don't let anybody make you feel less. You must be able to put yourself back. Don't entertain low self-esteem. Okay? Don't entertain low self-confidence. You don't need those things. It doesn't work anywhere. Now, we'll say this to relationship. Any relationship that stresses is not worth it. All of a sudden, that girl, Christina, is now a problem. She doesn't allow you rest. She is becoming a threat to your life. Bros, please leave her. Relationship is one thing that in the Bible, God had to let us make your choice. He gave us the opportunity, the privilege. You have liberty to choose whoever you want. So that at the end of the day, you won't say, after all, now God give me woman, that's why she's stressing me like this. Or now God give me man, that's why he's stressing me like this. If anybody in your relationship is disturbing, nothing is worth your life. Nothing is worth your life. At the expense of your life, the person is not worth it. You must learn to know when to put a stop to things that are not healthy for you. Depression is not healthy for you. Anxiety is not healthy for you. Okay? So please, take care of yourself. There's no particular soulmate out there. You can find your soulmate anywhere. So please. So when I say, please, have you seen a doctor? Don't feel like I am pushing you away or just a way to cut off the conversation. No. Now, let me bring this to our knowledge. I can only do not so much from my end. Why? I can only direct you, give you words of encouragement, because this is a field that that I'm in. I can only give you one or two techniques, direct you, give you ideas how you can do better, or tell you like where you go wrong. But the truth of the matter is that this is not my profession to start prescribing medication or drugs for you. That's why I will always say, please, it's okay to meet a doctor. And it's okay for you to tell me you don't want them to look at you a certain way. It's okay. And I'm there to support you, to encourage you to just be there, always check up on you. It is okay, but just understand that I can only do little from my end. And I'm never the kind of person that will advise you to go on self-medication. See a doctor. That's why he's a doctor, because he or she is an expert in this field. The person will be able to direct, and you see that at the end of it, it might not even be that deep. It might not be actually that of a big deal that you're thinking. Life is important. Kill fear. Let go of fear. You must learn to get rid of fear, because the fastest thing that can buy a man is fear. Fear can take your life away. Fear can take you out of this world. Let fear go. Kick off fear. Fear is not supposed to be in your life. You can do this, okay? And then again, when you meet a doctor, there are important facts they're going to be considering, which is basically what causes this. Okay, they're going to look at your behavioral aspect, the psychological aspect of it. Now, when we talk about the behavioral aspect of it, is when they give you like walk you through steps, exercises, techniques, method that you can actually use to control premature ejaculation, and maybe give you one or two drugs. Okay, and then the psychological aspect of it is when they reason with you. This is when they reason with your feelings, your emotions, see how strong, how, just to keep you in check, to know what might actually trigger this. Why are you going through this? What is the problem? And then figure out how your body system works and how your body responds to certain situations and conditions. Okay, so these are basically the parts they're going to be looking at. So they will ask you some questions. Don't feel bad, don't feel less. Some personal questions. They would want to know how it has been going for you and your partner. How are you able to handle it? What are the things you do? What is your life activities? What do you eat? What do you go through? How is life? How are you struggling? Are you okay? They just want to know, so that they can actually figure out where the problem is coming from. Okay, and now let me talk to us about the two. I'm going to give you the two most important techniques to be able to manage manage premature ejaculation. The first one, let's talk about the squeeze method. Yes, the squeeze method is that type where your partner stimulates your gula, and then at that point where you are about to pour out, you just pull it and then you squeeze. Squeeze is like draining to keep you. It's just like, you know trying to help you suppress a certain urge that's about to blow off, just for a few minutes. And when it's like it's going down a little bit, um then you kick off again. Yes, just suppress it. Most Okay, let me use my hairbrush. Most people can just to squeeze, you press, squeeze the way you squeeze out juice, like you squeeze lemon juice, and then you just squeeze it on yeah, just squeeze, and then it's a way of suppressing the 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 urge at the moment. The second method I'm going to talk to us is the start stop method. What is the start stop method? This is the part where you um once you okay, during intimacy, once you don't enter the woman or your partner, and then at that point where you are about to pour, and then you just bring it out, just rest for a little while, let the urge lessen, and then you still go back in, bringing it out, and then you're suppressing it. Now in this position, there are people, if your partner is well knowledgeable enough, can actually help guide you to be able to suppress the urge, just to lessen, and then you guys continue. Some people go as far as touching the tip of the bola, the tip of it, the tip. They just like you're pushing it one side, that kind of, I don't know, like you're pushing it to the left, you're pushing it to the right, you're pushing it to the back, you're going back and forth, that kind of thing. It's just a way you suppress the overflow. Then some people still go as massaging pushing it a little bit, the shaft, and then letting it slide, letting the urge lessen a little bit, and then you guys can continue. These are basically, and I will always advise, do this method, these two methods. You can actually do it like 3 times in a week. That way you're able to master the method and the technique, so that you know works for you. And the beautiful part of this is, you as a guy, once you start going once you start doing this method, you find out that at the end of the day, you just find a balance to it. At some point it becomes part of you. You won't even remember, yeah, I was once going through premature ejaculation. You and From these two methods I gave, you can even get another method for your own self, because at the end of the day, what works for Mr. XYZ might not be what will work for Mr. ABC. So from that, you can still get other method, other techniques that works for you, that you can actually use, and then you see your relationship flourishing. It doesn't bring distress to your relationship, and you do well. Okay, please. And I always say, ladies, don't make these men feel less of themselves. Don't make it look like it's a worst case scenario. Don't make it look like they have the worst disease. It's not even that deep. It's not a disease. It's just something that's happened. Now, as a matter of fact, 30 to 40% of people with Ebola go through premature ejaculation. So it's for you to see how common it is currently. Okay, so please take care of yourself. It's so much love coming from me to you. Let's spread the love. Let's be there for us. And I always appreciate you reaching out for me for any other personal issues that you want me to, address. Thank you guys so much. And then again, when you meet your doctor, there's this numbness cream and spray that can actually be used. But that's why I say, meet your doctor. When they hear you out, hear the things that you say, at the end of the day, they can say, okay, this is what we can do to help you manage this. Now, not this. There is no medication that cures premature ejaculation. Yes, there, or PE. There is no drugs, there's no medications currently, but there are some things they can actually give. There are drugs, there are numbness cream, numbness spray they can give you. There are exercises, method, techniques they can actually give you or teach you to help you manage it. From managing it, you see that at the end of the day, you even stop, time will come, you stop even remembering you once had premature ejaculation, because you've gotten used to it. Like, it's not a part of you, your own system, and it's okay, it's all good, you will be fine. So please always meet a doctor. I don't support personal self-medication. I don't support self-medication. Please, I can only give you method that can work for you, but it's still okay you meet a doctor for more consultation. Okay, thank you guys so much. Thank you so much. I love you guys. Don't forget to share this video, like my video, click on the notification bell, drop your comment, share this video, and bye.